What is the most likely diagnosis? A 34-year-old woman presents to the clinic with fatigue, dizziness, and amenorrhea for 6 months following a difficult delivery with significant blood loss. She has not been able to breastfeed her baby. On physical examination, she has hypotension and pallor. Laboratory tests reveal a low cortisol, low thyroid stimulating hormone, and a low prolactin level. An MRI of the brain shows an empty cella turcica. What's the following? What is the most likely diagnosis? Okay, well, I thought I had it. Every time and this is probably wrong. Okay, I don't think it's hypothyroidism. Pituitary apoplexy, Sheehan syndrome. It's not Addison's disease, and it's not a prolactinoma because it's obviously prolactinoma is low. I know Sheehan syndrome is when you have a very enlarged pituitary after, I think it's like maybe, I think it's after pregnancy when you would, and it basically just causes an infarction and you have low levels of like pituitary hormones. But the empty cell turcica syndrome is like a thing. I just know it's a thing. So my mind is leaning towards pituitary apoplexy now, but I don't know. So I'll go with that.
Okay, so pituitary apoplexy is sudden hemorrhage or infarct of pituitary, often in the setting of a pituitary adenoma. So it's like a blood collection. You'll actually see it. Okay, and it's all of a sudden, it's an acute setting, right? So this happened, if you look at it, is an acute, right? 6 months following a difficult delivery with significant blood loss. And so this is going to fit Sheehan syndrome, right? Sheehan syndrome usually, right? You have issues with your pituitary because it actually necroses. And when it necroses and dies, then 6 months later, you might not see it there. Does it make sense?
Yeah, and again, I for some reason, why do I empty cell turcica syndrome? I feel like that's a thing.
Yeah, it is. I mean, it's a separate diagnosis that you can have, with somebody who is more obese, that has increased intracranial pressure that presses down on the pituitary. Then slowly over time, that pressure will then cause the pituitary kind of deteriorate and then practically disappear, which is also called empty cell turcica syndrome, right? Where
Um,
you don't have a pituitary. But in this case, is a different mechanism. That's because they tell you that she had a difficult delivery with significant blood loss. So, following a pregnancy like that, losing a lot of blood, you can cause ischemia to the pituitary. Then the pituitary can kind of disappear because if you lose blood supply, then it dies. If it dies, if your body doesn't need it and it's dead, then it's going to kind of slowly deteriorate and be reabsorbed. Does it make sense?
yeah, yeah.
Pituitary apoplexy, like that's like an acute thing, right? Like you have like a pituitary adenoma or a tumor that bleeds, and then you have like a blood sac within your pituitary, which you'll see on the MRI.
Okay, okay.